Good afternoon, guys. I have B for you. We're discussing palliative care and hospice care, why society cannot ignore the needs of terminally ill patients and their loved ones. So, we're going to get into that for B. So, please join me for today's presentation I made for you. Please enjoy, folks. The title is Palliative Care and Hospice Care, Why Society Cannot Ignore the Needs of Terminally Ill Patients and Their Loved Ones. Main themes: death as a taboo. Society often avoids discussing death, leaving many unprepared to care for dying individuals. Emotional isolation. Terminally ill patients frequently feel abandoned and disconnected, highlighting the need for compassionate care. Role of palliative care. It complements creative treatments by focusing on pain relief and emotional, social, and spiritual support. World Hospice and Palliative Care Day, observed on October 12th, promotes awareness and progress and in promotes awareness and progress in integrating palliative care into health systems globally. Holistic approach, multidisciplinary care. Palliative care involves collaborations among healthcare providers, families, and support networks. Support for families. Bereavement care starts before death, helping loved ones cope with grief and loss. Quality of life. The goal is to help patients live actively and comfortably until the end. This article is a powerful reminder that end of life care isn't just about medicine, it's about dignity, connection, and humanity. Would you like to explore how palliative care differs from hospice care or how it's implemented in different countries? Absolutely. Palliative care offers a wide range of benefits that go beyond just managing physical symptoms. It's about enhancing life, even in the face of serious illness. Here's a breakdown of the key advantages, core beliefs of palliative care. Improve quality of life. It helps patients live more comfortably by addressing pain, fatigue, nausea, and other distressing symptoms. Emotional, emotional and psychological support. Palliative care teams include counselors and social workers who help patients and their families cope with anxiety, depression, and fear. Spiritual and social well being. Support is tailored to individual beliefs and values, helping patients find meaning and peace during difficult times. Support for families and caregivers. Loved ones receive guidance, respite and bereavement support, reducing caregiver burnout and improving satisfaction. Better communication and decision making. Specialists help patients understand their illness, explore treatment options, and make informed choices that align with their goals. Reduced hospital visits. By managing symptoms proactively, palliative care can decrease emergency room visits and hospitalizations. Longer survival in some cases. Studies show that patients receiving palliative care may live longer due to improved symptom control and reduced stress. Holistic approach. A holistic approach. Palliative care is not just end of life, it's for anyone facing a serious illness at any stage. It's like adding a layer of comfort and clarity to the medical journey. Helping people live as fully as possible. Would you like to see how palliative care is integrated into different healthcare systems or explore real life examples of its impact? Absolutely. Palliative care is incredibly versatile and can be tailored to many different medical situations. Here are some real world examples that show how it works in practice. Examples by condition. Cancer. A patient undergoing chemotherapy receives palliative care to manage nausea, fatigue, and pain. The team also helps with emotional support and decision making about treatment options. Okay, then we've got how palliative care handles chronic obstructive pulmonary disease or COPD. Palliative care helps ease breathing difficulties, provides oxygen therapy, and supports lifestyle adjustments to improve comfort. Okay, next condition, guys. Heart failure. Patients receive help managing fluid retention, fatigue, and anxiety. The care team also assists with advanced care planning and emotional support, neurological disorders. For conditions like Parkinson's or Alzheimer's, care focuses on maintaining dignity, managing cognitive decline, supporting caregivers. Organ failure. kidney, liver, etc. Patients may receive symptom relief, nutritional guidance, and support in navigating complex treatment decisions. Practical care plan example. A structured palliative care might include regular symptom tracking, pain, appetite, hydration, coordination with family and hospice professionals, planning for equipment needs, e.g., oxygen, hospital bed, things of that nature, also, folks. Okay. Emotional and spiritual counseling sessions. These examples show that palliative care isn't just about end of life, it's about improving life at every stage of serious illness. Would you like to explore how to build a personalized care plan or see how different countries implement palliative care systems? Absolutely. Palliative care spans a wide range of medical conditions, each with its own unique challenges. Here are more examples to show how palliative care adapts to different illnesses. Neurological conditions, amyotrophic lateral sclerosis or ALS. Palliative care helps manage muscle weakness, breathing difficulties, and communication challenges. It also supports families through progressive decline. Okay, then we've got multiple sclerosis, MS, focuses on pain relief, fatigue management, and emotional support during relapses and progression. Parkinson's disease addresses tremors, mobility issues, and mental health concerns like depression and anxiety. Cardiovascular and pulmonary conditions. Heart failure manages breathlessness, swelling, and fatigue. Also helps with advanced care planning and emotional coping. Chronic obstructive pulmonary disease, COPD, offers oxygen therapy, breathing exercises, and support for anxiety-related breathlessness. Pulmonary fibrosis helps with symptom control and decision making around oxygen use and activity levels. Cancer types. Breast cancer manages pain, nausea from chemotherapy, and body image concerns. Pancreatic cancer provides intensive symptom relief and emotional support due to rapid progression. Leukemia and lymphoma supports patients through long treatment cycles and immune suppression. Organ failure, kidney disease assists with dialysis, related fatigue, dietary changes or challenges, and end of life decisions. Liver disease manages symptoms like itching, fatigue, and confusion due to uh, hepatic encephalopathy, cognitive disorders. Alzheimer's and dementia focuses on maintaining dignity, managing behavioral symptoms, and supporting caregivers through long term decline. Infectious disease, HIV/AIDS, provides pain relief, emotional support, and help navigating complex medication regimens. Okay. Folks, it also covers COVID-19, offers symptoms control, breathing support, and family communication during isolation. These examples show how palliative care is not one size fits all. It's a flexible, compassionate approach tailored to each person's medical and emotional landscape. Would you like to explore how to initiate palliative care conversations with a healthcare provider, or what insurance typically covers? All right, guys, that's B for you. I'll be back on shortly with C. Give me a little bit to put that together for you, and I'll be back on with that shortly. For now, Gator Wellness, take care, folks.